looks like you all are raring to go. So let's officially kick off our Maxicare Wellness Fridays. Welcome to Maxi Life Wellness Fridays featuring Color It Pink, breast cancer awareness, detection, and cure. Again, I'm Patricia Bermudez-Hizon, your host for this event. Happy to be wearing pink in support of this wonderful occasion because pink, the color that has been associated with October and breast cancer, and of course, the color that's been associated of the support for this. This color also represents good health, of course, femininity, and cheerfulness. In championing this cause, prevention, detection, and cure all encompass breast cancer awareness. So join us as we discuss and shed more light on breast cancer and continue to raise awareness on this very important topic. Now it's time to meet our speaker. She has been practicing as a breast surgeon with extensive experience in hospital and clinical settings. She is on the board of directors at the Philippine Society of Breast Surgeons. She has had her fellowship training in breast surgical oncology at the National Cancer Center, Singapore, and was a clinical associate at the Department of General Surgery in Singapore General Hospital. With all of these, she has an overseas and local exposure in breast oncoplastic surgery. Happy to be welcoming and introducing to you Dr. Remy Caris Velasco.
Hi, Ms. Patricia. Thank you for your very warm introduction. Let me share my screen. Okay, hi, good afternoon. So for today, I'll be talking about Colored Pink, breast cancer prevention, detection, and cure. I'm Dr. Velasco, and I'm a breast surgeon. For this afternoon, I have no disclosure, and I'm not representing any society or hospital. And I always like to have an outline of what I'm going to discuss for today. So we'll talk about October, which is the uh, internationally declared Breast Cancer Awareness Month, the prevention of breast cancer, where we will talk about the different risk factors, those that we can prevent and those that are already there, but we can do something about it so that we can have early screening or early detection. So when we go to the detection part, we will all discuss or talk about screening and diagnosis of breast cancer. I'll also talk about, of course, if you have breast cancer, what's the cure and treatment options for breast cancer? And once a patient survives, what do we do? That's surveillance follow-up, consult, and clinic visit. And those who survive breast cancer, how they cope out with their life. And of course, because it's time of pandemic, I also touch on a little bit on what breast surgeons do during this COVID-19 pandemic. So to start with, I'll talk about pink ribbon. You will see not just October, but most of the breast surgeons or most of surgeons who support or doctors, patients, or any individual who have support for breast cancer awareness usually would wear a pink ribbon on their left chest or on their clothes, because this one is the international symbol for breast cancer awareness. And as Ms. Patricia had mentioned, it stands for femininity, caring. It means beautiful, and it means good also. So despite having breast cancer, especially women, because most of our patients are female, we still would want them to have a brighter outlook on life and live their lives normally, because we are here to help them to give treatment and to make and improve the quality of life with breast cancer. Okay, so it's first day of October today. So I think this is the best way to start this month, okay, to give awareness and to give information to all of you guys what breast cancer is all about. So when you talk about awareness, which Maxicare is promoting, this means consciousness or having concern on something and being knowledgeable. So I'm here this afternoon to make you well informed, okay? Not just Dr. Google, but we'll be giving you the right information about breast cancer. And I know a lot of you have myths that you can read online, and you don't know which one is true, or is it factual information, or it is just a rumor about breast cancer. And when you say wellness, this is the state of being in good health, okay, and you actively pursue that goal. So not no one in this world would want to have sickness, or would wish for cancer. So we're here when you have awareness, and when your goal is to have wellness, or to have good health, which is very important now, especially this time of pandemic. um, you will then try to avoid the factors that can make you sick, or that's by keeping your body healthy. Okay, so it's October, and you will see a lot of publications, advertisements, promotions. It's the start of October. You will see online people campaigning for support for breast cancer, doctors doing research about breast cancer treatment, and updating everyone of what the latest information and treatment for breast cancer. So this particular slide is one of my favorite, because it's a man, and then there's a 3D tattoo on the photo, where it tried to grasp the two breasts. So it says there, if only women paid as much attention to their breasts as men do. So what does that mean? Because what a woman different, what is the big difference with a man and a woman is the presence of breast. When they have breasts, it means you're a woman. And I think I always tell my patients that the breast is your best female accessory, not your jewelers or anything. It what makes you stand out, and what makes you a woman. And so you will see a lot of uh, advertisements that support our boobs, find a cure, and if you can read on my slide, are you obsessed with the right things? I think if women really pay attention on their breasts, we will always have early detection of breast cancer, and we can promise them a very good survival rate and a good prognosis. It means that when you detect it early, it really will save your life. Okay, so you might be tired of hearing about it, but breast cancer awareness matters more than ever. And when you have awareness, this lessens the scare or the fear from the patient, and that transforms into confidence and security and even courage to see a doctor, to go to the clinic, and then ask the doctor correct information if they have cancer or not. Most of the women that I talk to, when you ask them if they do a self breast exam, it means you check your breast for lumps or for any skin changes. They usually would tell me, "Oh, I don't do that because I'm so scared." So the first thing I always tell my patients is it's always good to regularly check your breast, do a self breast examination, which I'll be talking about in a little while, so that when you see any changes or that can mean breast cancer, we can always treat you very early. And I always also stress this point or give emphasis that when you find a lump on your breast, it doesn't mean that it's automatically cancer. There are breast lumps that we call them benign, meaning they're not cancer. And of course, the first scare or the first thing that a woman or even men, although there's very low percentage of patients who have breast cancer for male, would always want to hear the good news that it's not cancer. So as we go along, I will discuss to you how we diagnose breast cancer and how we treat it and what screening modalities that we do so that we can do early detection. Okay, so first and foremost, we have to know what breast cancer is. So it always starts when the cells in the breast begin to grow out of control. So meaning uh, growth in the body is a natural process, but when it becomes abnormal in a certain organ or a specific organ, that's when we need to find out whether this growth or this new growth, is it out of control? Is it a new growth that's just a lump that stays the same size in the coming years, or is it the big C, which is cancer that grows out of control? So we call it malignant, okay, when it's cancer, and if the cells can grow into surrounding tissue, so meaning like for breast, it involves the fatty tissue that surrounds it, or the skin that overlies the breast, we call it um, invasive cancer. And when it's spread to the distant organs, which is the scare of a lot of people, and even this is the big or the most terrible threat for cancer surgeons, is when it spreads already to the distant organs or to other parts of the body. Okay, so how frequent is breast cancer? So, worldwide, breast cancer is the most frequently diagnosed life threatening cancer in women and the leading cause of cancer death among women. And I only included here from the American Cancer Society the rate of breast cancer per 100,000 women for Asian, because we are Filipinos. So it's actually 90.7. But if you look at Philippine data, um, there 4 5 years ago, Philippines was named as one of the regions in Southeast Asia, or in the entire Asia, which has the highest incidence of breast cancer. But our data in the Philippines is a bit inconsistent, but we are improving it now because we are having our cancer database already. And because our country is a big island, okay, and our population is a lot. And of course, some remote areas still don't have any access to surgical care. So it's still inconsistent. But knowing that breast cancer exists in the country also would tell us that we need to be aware of what causes breast cancer and what treatment options are available. Okay, so can we prevent it? Can we stop breast cancer from happening? So we have a lot of risk factors that were identified by clinical trials and research. Of course, the age which usually breast cancer happens and peaks at 40 years old, and then 40 to 50 years old, and then it plateaus and it peaks again at 70 years old. And female are more prone to have breast cancer because of the presence of female hormones, which is the estrogen and progesterone. And we usually ask patients also if they have a family history of breast cancer, especially if it's a first degree relative. It means that you have increased risk for breast cancer, and it increases up to fourfold. But of course, we use mathematic assessment models to estimate the risk of these patients who are most likely would have breast cancer. And the last one will be the prior breast health history. So you will hear patients that, oh, I have history of breast cyst or breast mass removal a few years ago, and we would always want to know what the pathology or what the report was, so that we can also advise these patients if those particular reports are high risk lesions of the breast that will give them increased risk of breast cancer. So for the family history, we always would ask if they have two or more relatives with breast and ovarian cancer, because breast, of course, ovaries produce the female hormones. That's why it's interrelated. And we always ask about the presence of ovarian cancer also because the female hormones, I mentioned the estrogen and progesterone are the two main hormones that influence both the ductal and lobular development of the breast or breast changes. And if also you have a relative who had breast cancer younger than 50 years old, those relatives with breast cancer and ovarian cancer, and one or more relatives with two cancer, meaning breast and ovarian, or two independent cancers, male relatives with breast cancer. So these are the strong risk factors. You will hear about BRCA1 and BRCA2, which I will show a slide later. Mutations, these are the hereditary breast cancer. Also the ataxia telangiectasia heterozygous. This is a specific gene also that predispose a person to having high risk of breast cancer, and a specific race, also the Ashkenazi Jewish descent. And for the reproductive and steroid hormones, okay, if a woman has late age at first pregnancy, so meaning late age would include late 30s, like 39, 40, or early 40s. Nulliparity, meaning they haven't been pregnant in their entire life or no children at all, or early onset of menses, meaning they had their menses at 10 years old, and then the last one will be, or finally, the late age of menopause, meaning the usual age would be 50, and then if they had their menopause at 55 or 60, okay, that's already considered a late age of menopause. And if you will try to understand what these factors tell us, the common denominator is the exposure to the female hormones, which is the estrogen. Because when you have your menses, your estrogen levels increases also. And if you become pregnant, okay, that's the time that they decline because you are pregnant. So your exposure to estrogen is lesser. So the length of time is lesser. Late age of menopause, meaning you are still having your menstrual period. So the progesterone and estrogen are continuously secreted. So that's also puts you to higher exposure to female hormones, which is estrogen and progesterone. Okay, so of course, for the risk factors, we also have the lifestyle and diet. Okay, so obesity is associated with increased risk of breast cancer because of cholesterol, okay, or fat. Okay, tobacco smoke, all right, and dietary products like the charred and processed meat, alcohol consumption, and of course, environmental carcinogens. This is exposure to pesticides, radiation, those people who at their young age receive treatment for radiation, especially on the chest, and environmental and dietary estrogens, those who take high amounts of estrogen also are predisposed to developing breast cancer. Okay, now that we know that the risk factors, so we now know how to like at least lessen or prevent the risk of breast cancer. But how do we know, or how does a person know that he or she has it? So so let's go to the how we detect breast cancer. So early detection, of course, saves lives. And if you have an early stage of breast cancer, the survival rate is almost 90 to 100%. Okay, so many early breast carcinoma are actually asymptomatic, meaning a patient don't doesn't experience any symptoms. But usually, pain or discomfort is not associated with cancer, but it can be a symptom. Okay, that usually patient would complain of pain, and then they go to a doctor, and then we will find on imaging that there is a lump or abnormality on mammogram, and it's usually first detected as abnormality on mammogram before it's even felt by the patient or the healthcare provider. Okay, so what are the signs of symptoms of breast cancer? We have it can be change in the breast size or shape. Okay, so I'm talking about if the breast became suddenly bigger, okay, or it can also be smaller because some cancer types causes skin retraction. So some patients would notice that oh, their breast became a bit smaller. The shape, okay, if there is distortion on your breast, it can also be a sign or a symptom. Skin dimpling or skin changes, it can be thickening. Okay, if I will talk in Tagalog, thickening means pangangapal ng balat. Okay, swelling, that's pamamaga, namamaga po siya, or redness, namula po yung breast. Okay, so or even recent nipple inversion or changes or other nipple abnormalities like ulceration. These are the ones. Okay, retraction if you are not born with an inverted nipple. Okay, if it's a recent change, it can be a sign of breast cancer. Or spontaneous bloody discharge, meaning you don't do anything, you don't press your breast, you don't touch your nipple, but there's a bloody discharge coming out of the nipple. So if it's blood stain particularly, it's usually sometimes it can mean breast cancer also. And of course, when you say axillary lump, that the axilla is the area of your armpit. If you have mass there, it can mean a lymph node, or in Tagalog they call it colane. Okay, so because the first area where breast cancer is spread is to the lymph nodes, which is the area of the armpit. Okay, so what do you look for? Okay, I think this one is a good a representation of what I just talked about. So you look for the lump, okay, a pulled in nipple or the retracted nipple, dimpling, okay, or dripping, meaning nipple discharge, redness or rash. Okay, some breast cancer types, they present rash on the nipple area, or skin changes, any skin changes, bruise, redness, or thickening or edema. These are the early signs of breast cancer. Okay, so how do we do clinical examination? How do you perform a self breast exam? So I always tell my patients to do their examination a week after their menses, because this is usually the time where the breast is stable at its normal condition, and it's not influenced by menses, and it's not painful. If of course women would understand it whenever they're about to have their period, they would usually complain that my breasts are tender, my breasts are sensitive, and when they have their period, a week after that, the pain is already gone, and the breasts are no more very sensitive. So you can do, and you can actually palpate or feel a lump um, accurately and precisely, because during menses or right before the menses, the breasts are too engorged, and you might miss a small lump also when you do your clinical examination or self breast exam. You can do it standing, you can do it lying down, okay, or you lean forward when you examine your breast. So as shown in the diagram, it can be direction of upwards and downwards, or you can do radial. Okay, that's in Tagalog, it's paikot, or towards the nipple. Okay, so same's true when you are lying down. And of course, you also feel for your armpit, okay, for presence of any lumps there, which means enlarged lymph nodes. Okay, so what is the general approach, and how do we diagnose breast cancer? It always comes in three. Okay, so we call it a triple assessment. That's a clinical examination. Okay, that's when you go to the doctor, and then they will inspect your breast, and then and of course at the same time palpate it or feel it for to look for lumps. Imaging. Okay, these you will always hear ultrasound and mammogram, or we can do both or one as initial diagnostic procedure to check if there is presence of lump, and the needle biopsy, meaning we get a sample of the tissue from the lump, and then have it evaluated by the pathologist under the microscope in the laboratory. So we can only diagnose breast cancer once these three come together. So we need to have clinical examination first, imaging, okay, and of course, the most important and the final say is the biopsy. Okay, so this is a good representation also. So you will see a doctor palpating or examining the breast, and then do either the ultrasound or mammogram. Sometimes we request both if it is necessary. And when we do a needle biopsy, that's a core needle biopsy when we submit specimen or tissue from the mass and have it assessed by pathologists. So that's how breast cancer is diagnosed. Okay, so for the imaging, the most common that we perform is ultrasound. So don't be scared when you do ultrasound because ultrasound has no radiation. It uses sound waves and it produces images that helps surgeons or doctors to see whether there is presence of lump or changes in the breast. And the mammogram, most of my patients will ask me, Dr. Velasco, is it painful or is it okay to do mammogram because it's a form of X-ray? So they will tell me, oh, is this mammogram safe for me because that's X-ray? So I always tell my patients, our machines now, especially here in Metro Manila or even other areas in Mindanao and Visayas, they have their latest mammograms already that they don't cause pain. It's only a little bit of discomfort because they will try to compress the breast and do it's like an X-ray, and the exposure to radiation, the amount is not very significant, okay, to cause cancer on that area. It's like when you go uh, to when you travel, when they check you to the plane for X-ray. It's like that also in mammogram, but unfortunately now we can all not travel. Okay, so for the tissue biopsy, okay, this is how it's performed. It's an outpatient procedure. So once that the doctor sees on the images that you have a lump on the breast and it needs to be um, biopsy, that means it can be a suspicious lump or some benign nodules. If they're very big, we also request for tissue biopsy. These are lumps that grow bigger, but they're not cancer. So the best thing is to do biopsy, wherein we take sample of the lump and then have it examined. So it's an outpatient. It's usually with image guidance, and we usually perform ultrasound with it. And once it's targeted and we get the sample, then we send it to the laboratory. And it's not very scary. Okay, so we have different types of biopsy. We start with the small needle, fine needle aspiration biopsy if the lump is very small, but this is particularly done on the axillary area or the armpit. The standard is we use core needle for breast because this gives us a tissue diagnosis rather than a cellular diagnosis. We also have vacuum assisted biopsy for very small lumps that we think it might be missed by core biopsy. This is a minimally invasive procedure where they use special needle. It's like a revolver needle, and you take the lump entirely and remove it with just very, very small incision or cut. And we also have ABBI, but I don't think they do it here. And of course, open surgical, wherein these are the type of biopsy also where they um, make a small incision and then they remove the incision or cut and then they remove the entire lump. Okay, so how about when a patient is already diagnosed with breast cancer? So there are stages of breast cancer. You will hear patient, oh, I'm stage 1, stage 2, stage 3, or stage 4. So there are bases for that. We usually use the Pnm staging. P is for the tumor, that's the size of the lump. So as you can see on your screen. Node is for the lymph nodes. I mentioned that on the armpit, okay, if there's presence of that. And M is for metastasis, meaning this is distant spread or presence of a cancer cell to a distant organ or to other organs aside from breast and the axillary lymph nodes. Okay, so once we have the diagnosis already, we look at the other organs if needed or necessary. We perform blood tests for the patient, and then we do scans also, either ultrasound or CT scan of the whole abdomen, bone scan, and sometimes if for advanced diseases, we even perform a PET CT scan. Okay, so I mentioned there are different stages. We have stage 0, which is, if you will hear people say, ductal carcinoma in situ, stage 1, 2, 3, and 4. And we have a lot of trials already evaluated what the survival rate for this specific stages, and the 5-year survival rate, of course, for stage 0 is actually 100%. For stage 1 is 98, and then stage 2 is 93. 72 and 28, of course, it goes down. Survival rate goes down when the stage becomes advanced. Okay, so we also have different types of breast cancer. You will hear people, oh, my friend or my relative has a triple negative breast cancer, her HER2 positive breast cancer, ER positive breast cancer. So these are the different types, and our treatment is usually based on if the tumor or the cancer is expressing all these receptors. So before, in the olden times, they weren't able to classify what type of breast cancer now. So now what I'm trying to say is these days, the treatment for breast cancer is already very specific, and it's targeted for a particular type of breast cancer. Okay, so we also have additional tests. You will hear people talk about genetic tests, BRCA1, BRCA2. These are the hereditary breast cancer, but I will tell you that the rate of or incidence of hereditary breast cancer is only about 5 to 10%. And the rest, meaning 90 to 95%, are sporadic, meaning they just happen at irregular intervals. Okay, and also, for genetic testing, of course, these are the types of breast cancer that are passed on from generation to generation or from parents to offspring. We also have genomic tests when we test the lump itself, the tumor itself. This is the profile of the specific tumor. You will hear your friends or other doctors talk about Oncotype, MammaPrint, ProSigna, or PAM50. These are the available tests here in the Philippines. If that usually would look at recurrence score of that particular tumor, and that helps us decide also whether additional treatment like chemotherapy will still be beneficial to a particular patient, but of course to properly selected individuals. Okay, so when it's diagnosed, what's next? We should find a cure, and we should give treatment to breast cancer. So the mainstay of treatment is the removal of cancer, meaning surgery. Okay, so that's why we're here to help you with breast cancer, and it's a solid organ. So if you have the lump, it has to be removed. Okay, and there are different ways of or different surgical approaches that we offer to our patient. It can be just lumpectomy, meaning we just remove the lump and normal tissue around it, and we still have the breast. That's breast conserving surgery. But of course, when patients opt to have this procedure, it's always paired with radiation therapy to lessen recurrence rate for that particular breast. Okay, and some patients also choose or are not candidates for breast cancer, for breast conserving surgery, and that's when we remove the entire breast together with the nipple and the areola, and we call it mastectomy. Okay, but don't be scared with that, because we can always offer patients oncoplastic surgery. Okay, meaning even if you remove the lump or just normal tissue around it, we can always play around with breast tissue and then still maintain the contour and shape of the breast. The other one is plastic or reconstructive surgery, especially those who underwent complete removal of the breast, we can give them a new breast that has no breast cancer. Okay, so we can use either the uh, autologous uh, autologous implant, or uh, with prosthetic, meaning we can put silicone, or we can use the patient's own tissue or muscle to replace the breast that was removed. All right. So aside from surgery, we have additional or adjuvant treatment also. This is, you will hear people or patients having chemotherapy. I place this neoadjuvant and adjuvant because some people will hear them, oh, they had the chemotherapy first and then they had surgery. That's when we term it neoadjuvant, meaning it's given before surgery. Maybe they have uh, a locally advanced disease, meaning we need to shrink the tumor first before we can perform the surgery to achieve negative margins. And adjuvant is after surgery for earlier stages of breast cancer that would need chemotherapy. And the other one is targeted therapy. You will hear patients, oh, I had treatment for a year, the very expensive treatment. These are the anti-HER2 treatment that are very effective and even achieve a complete pathologic response, meaning when we give this type of treatment, the tumor actually shrinks completely. And it means that these patients are very responsive to treatment. And another one I mentioned, radiation therapy. We have the usual or conventional radiation that is performed after surgery, especially for breast conserving surgery. And we also have the new technique now, which is intraoperative radiation therapy for breast, where we do the radiation right after the surgery. But of course, this one has criteria for eligible patients. And it's also available in the country. Okay, so, and of course, we also have the hormonal therapy. You will hear patients taking either tamoxifen or raloxifene, aromatase inhibitors, or GnRH, the injectable ones, or ablative therapy. They will always take it usually minimum of 5 years to prevent breast cancer recurrence. So these are, we call them chemo prevention. So meaning to avoid or prevent the breast cancer from coming back, because recurrence is one of the scare of both the doctor and the patient. Okay, so once the patient has already completed the treatment and she is already free of cancer, we do surveillance also. So the care for breast cancer does not just end with surgery, with chemotherapy, with radiation, or with hormonal, but there are essential management for breast cancer survivors. We usually would ask them to go back to our clinic to take history, okay, check the area of where we operated on, do imaging studies also to check the other breast, drug related side effects. Those people who are on hormonal therapy, we need to give them supplements to protect them from side effects, because they're taking this for a minimum of 5 years. So that's kind of long time. And we also advise our patients to have lifestyle modification, eat the right and adequate diet, and also exercise. And the genetic counseling and tests usually comes in, especially if they have strong family of strong history of breast cancer. And the last one is very important for very young patients who has or who were diagnosed with breast cancer and are going to be treated. We usually discuss fertility, meaning when they can be pregnant, or can they still be pregnant even if with breast cancer. And these are all discussed with the patient. So what I'm trying to say is we usually do a multidisciplinary approach, and we see patients holistically. Okay, so when they survive, okay, meaning We usually call them survivors past 5 years because that's when the time that the recurrence rate already goes down. So meaning there's lower chance of the breast cancer to be coming back. So we educate people. We tell them what to watch out, what to do, and then if ever they feel another lump, okay, what's the next thing to do? And of course, not just the medical or surgical treatment, we also advise them financially, emotional support, counseling. Family is very important, and even in the household, and also the other treatment. And for those who undergo reconstruction, we even ask plastic surgeons to help us also explain the complicated procedures. But this will, of course, improve the quality of life of especially women. Okay, so what do we do next? I've talked about a lot of things about breast cancer. Where do we go? So for general population, meaning those with average risk women, they have no symptoms, no history of breast cancer. We usually would advise them to do self breast exam at age 20. Okay, and when you reach 30, you go to the doctor for clinical examination if you need further imaging like ultrasound or mammogram. And for women who reach 40 years old, okay, we recommend yearly mammogram as screening, meaning because there are abnormalities or findings in the breast that are not that cannot be felt. So these are what we call incidental findings on screening, and we pick up a lot of um, early breast cancer with a screening mammogram. And at the age of 50 and up, that's 2 yearly mammogram, as long as, of course, the patient is in good health. And the very famous Angelina Jolie. So this is the BRCA1 and BRCA2 gene. Those who are carriers, we usually advise them go to genetic clinic or counseling, where we advise enhanced surveillance, meaning we do a more aggressive surveillance for them because these patients are considered high risk, and some patients even have chemo prevention and risk reducing surgery, like what Angelina Jolie did. She had a double mastectomy because her risk for breast cancer is high because she's positive for the this high susceptibility gene for breast cancer. So what now? Can I still tell you more? Okay, there's a lot of frequently asked questions, and one of them is, if you get hit in the breast or trauma, you get breast cancer. The answer is no, but it's always an important event when women go to the clinic, because they will say, oh, I got hit by my baby and then I had the lump, when in fact the lump is already there even before the incident. And can you get breast cancer from smoking and alcohol? I think I already mentioned that it's a risk factor, but of course it's not automatic. Can breast cancer be brought by stress? Okay, so anything that is very stressful, okay, your immune system gets down, so that also, of course, puts you to risk of getting any disease, not just cancer. So is mammogram good or bad? I mentioned that already. Is there a cure for breast cancer? Of course. We always aim for a curative intent when patients go to us, especially for early stages. And is biopsy safe? Because they're all scared if they have the biopsy, and then they'll be the cancer will go to other areas. Of course, it's safe. Else we won't be doing biopsies anymore. And lastly, of course, for pandemic, a lot of organizations met at the start of pandemic, collaborated to come up with specific guidelines on what to do with breast cancer patients during the time of COVID. And our stand is the guidelines and indications for the treatment of breast cancer remains the same, even in the time of pandemic. And of course, there is prioritization of patients during pandemic. We classify them if they need the surgery urgently, or if it's emergency or an elective, and even the timing of treatment also is discussed with the patient. So with that, since my talk is color it pink, I'll end it with pink. Okay, the acronym pink. P is please prevent. breast cancer, you have to exercise more, eat better, drink less, and stop smoking. I identify breast changes. That's when you go to your doctor, and never miss a mammogram if you're 40, or talk to your doctor if you need it. And then K, know the facts. All right, not just the rumors or myths about breast cancer. And that's the very reason why we're here and talking about breast cancer. And with that, I thank you for your kind attention. Back to you, Miss Patricia.
Thank you so much, Dr. Remy. You know, all of our Maxicare members, myself included, learned so much about the topic and are now ready to ask our questions, their questions, our Maxicare members. Allow me to introduce now our expert who will facilitate the Q&A. She is a fellow of the Philippine Society of Surgical Oncology and a member of the Philippine Society of Breast Surgeons. She's also the head of Tumor Board Committee of Our Lady of Lourdes and an active consultant of JRRMMC and UniHealth, and a visiting consultant also of St. Luke's Medical Center. Happy to have Dr. Helen Amo. Hi, Dr. Helen.
Hi, Miss Pat. Thank you very much for that kind introduction. So good afternoon, everyone, to all who are present here. Of course, you have just listened to a very comprehensive talk by Dr. Remy regarding the clinical manifestations and the different treatment approach for breast cancer. Now, it is time to address all the questions that are or have been boggling the minds of our audience regarding this big C. So, Dr. Remy, are you ready to answer all the questions? We have quite a few, and other questions are very interesting.
Yeah, okay.
Okay,
Go ahead,
so
Dr. Helen. You
all
can
right,
start
so to
answering the
start,
questions.
okay, I have already lumped them together, those who have quite the same questions. All right, a few questions also you have also tackled in your lecture, but we can again reiterate. Okay, so the first question is, what are the symptoms of breast cancer? Is a heartburn-like feeling related to the breast?
Yeah, okay. So a heartburn usually it's not okay, because usually if a heartburn is usually a manifestation of a gastrointestinal disease. Okay, meaning it's coming from inside. So I think if our audience are paying attention, I told them it's a breast is an accessory. Okay, so it's an organ that's attached to the chest wall. So heartburn is not related to that. I think the best answer to that is um, see a doctor so that they can differentiate if that one is related to your tummy, or is it a heart problem. Okay, it's also good to any surgeon can differentiate that also.
All right. Thank you, Doc. So I hope that answers our first question. So another question here is, this is also the most common questions now our patients ask regarding diet and food. So what is your opinion about low carb diet and intermittent fasting to prevent cancer? Another question to follow that is eating sweets like chocolates may cause breast problem? And for those who are, what are the percentage of women who are obese under the obese category who has breast cancer?
Okay, so I'll answer the first question first about the diet. Okay. Even my cancer patient would always ask me, Dr. Velasco, can I still eat alimango? Okay, alige? Or I said, go ahead. All right. So
Yeah.
I think for diet, everything should be in moderation. Okay, anything in excess, even if a very low carb diet is not good, so much intermittent fasting also it's no good. If you take keto or like super high fat diet is no good. So I think anything, whatever diet it is, okay, in life or in general, life is a balance. So you can't have an excess of anything. So everything should be in moderation. But I specifically instruct my patients, especially those who undergo chemotherapy, because their immune system is down, to prevent processed food or those that are preserved food. So I would ask them or advise them to eat fresh food, okay, if possible. All right, but they can still eat crab, but of course in moderation. That's a specific food that they always ask me, the alige and all, because it's made up of cholesterol. But if you look at epidemiologic studies, the diet that usually would put patients to like higher risk of breast cancer is usually the cholesterol, and this is associated because Dr. Helen would know it. The estrogen's building blocks is cholesterol. That's why even obesity. So I'll lean on to the next question already, is associated with breast cancer because of cholesterol. But to ask me what the percent is, we have no like data on that because it's so hard to do epidemiologic studies. Even if you read about risk factors for diet and alcohol consumption or even tobacco, they will not give you like a certain or specific amount. Although, if we will be very technical about it, there are computations, all right? So we can advise patients on that. Yeah.
Okay, thank you very much, Doc. You're actually a very correct, no? Everything should be in moderation.
Yes, life is a
Okay,
balance. That's
yeah.
what my boss always tell me.
Okay, Doc. So during this time of pandemic, people are actually really afraid to go out or are not allowed to go out because of some restrictions. So we have a question here: is teleconsult recommended as initial consultation, or uh, do patients have to be physically present for the consultation?
Yeah, okay. So it's a very good question, and it's a very timely question also. That's why I mentioned about the prioritization of patients. Of course, I didn't specifically talk about it because that's a bit long. You know the guidelines. It's like a booklet of guidelines. So for that question, they can actually see there are a lot of surgeons who do teleconsult, okay, so that they can do history taking first, and then can request for imaging procedures like mammogram or ultrasound. We can actually tell when we talk to patients online, okay, if they're scared to go face to face first. And I always remind my patients when we do teleconsult that if we need to see them face to face, of course, we can't avoid that, especially for suspicious lesions. But
Yeah.
sometimes the usual flow is to see them online first, and then we request for either mammogram or ultrasound. And then if we find something, we request for biopsy. And once we have the diagnosis, that's the time that we see them face to face and then advise them so that we can see physically how the breast look like, and then we can tell them what type of surgery they will be needing. Okay, and not all who have underwent biopsy will eventually go for cancer surgery. Some biopsies will tell us benign conditions. Okay, and that's when we classify them if we need them to remove immediately, or can we um, buy more time when the pandemic at least gets controlled. So the bottom line here is don't be scared to talk to your doctor. Yeah, so
Yes,
that's the
Doc.
only time that you will have the right information and what the next step to do
Yes, I actually practice the same thing, no? So I usually see my patients virtually first,
initially
and
first.
then
Yeah.
yes, doc, like what you said or how you actually do describe it. Okay, so thank you for that. Now we have questions naman regarding the different types of lumps that are seen, no? So how do they actually know when they do their self breast exam if what they are actually palpating is a cyst, or is it the muscle or bone or any part of the breast tissue? And is what is the likelihood that a breast lump is cancerous?
Yeah. So I always ask my patients to do self breast exam when they shower. Okay, when they shower at because nobody can see them, because sometimes when they're in their room, somebody enters, or they're too shy to do it. So when you shower, okay, and then when they use their liquid soap, that's the time that you can actually really feel your breast. And if you feel something like a lump or a distortion, okay, if it's movable and smooth, Okay, usually and for young patients, usually these are the we call it fibroadenomas that are movable and they're not fixed to the chest wall. But of course, if the lump is attached to the chest wall, when they feel it, they can't move it anymore. So these are the uh, possible signs that that lump is breast cancer. To differentiate a cyst from a solid nodule, when you say cyst, it's made up of fluid, and then a nodule, it's a solid one. I think for patients, it will be a bit hard or difficult for them to differentiate. Okay, that's when the time that you will need to go to a surgeon or a general. Sometimes they go to a general practitioner for initial consult or to a friend, a family doctor. So um, I think for that differentiation, it's the doctor that will guide them, okay, and tell them which signs or symptoms are would possibly suspect a diagnosis of breast cancer. Of course, for those with intact skin, usually it's not, and if it's movable. But for those with ulcerations already, I've seen patients who are advanced stage. They go to me, and the entire breast is already a tumor, and there's a foul smelling discharge. Of course, these findings are already tells us most likely that we are dealing with breast cancer, not just early stage, but a locally advanced already, because it involves the skin already. Yeah, so as much as possible, when you detect it early, you go. Uh, I think the main purpose for this afternoon or for today's session is to lessen the fear of patients going to the doctor and replace it with confidence and security that breast cancer can be treated.
Yes, thank you, Doc. So you mentioned about performing the self-breast exam. So there's actually a question here. Is it enough or your regular annual physical examination with the doctor enough for detection of breast cancer? And when is the best time to do self-breast exam? I know you mentioned it during your
Yeah.
lecture.
Mhm. And it's very important. So let's point that out clearly to them. The timing, okay, when to do it is usually a week after menses. So if you have like today, it's October 1st, all right. If you have your menses today, you wait for a week and then you can examine it October 8th, all right. And that's when that's a time that breasts are usually on their normal condition, not influenced by any hormones. Okay, the frequency of visit to the doctor. I think I mentioned 20 years old, 30 years old, and all that. Um, for average women with no risk, okay, I'm talking about people who with no symptoms and no family history of breast cancer, especially for their first relative, they can do yearly mammogram, and as long as the results are normal, they don't need to go to the doctor every day or call them every day. Oh, do I have am I in increased risk of breast cancer and all that? So for average women, a yearly mammogram is already enough. And it's a good thing that actually other countries, they have breast cancer screening, and hopefully here in the Philippines also will be able to develop that as well. So these are women with no signs and symptoms, and they go for mammogram.
Yes, Doc, you mentioned about mammogram, but what about ultrasound? How often should it be done? And how
Yeah.
accurate is it for cancer screening?
Yeah, okay. So for younger patients, we usually do ultrasound, because if you perform mammogram on a very young patient, you won't see anything. You will see white image on mammogram. So for younger patients, especially younger than 40 and the 20s, who usually would go to you with the lump, we usually just request for an ultrasound. And the frequency of ultrasound, okay, this is my practice. If it is a benign lesion, okay, and that doesn't need to be removed, and most likely it's not cancer, Okay, we do a short interval follow-up. We do a baseline ultrasound first and then do interval follow-up after 6 months. All right. And then if it's stable for 2 years, they can actually even stop doing ultrasound if it's really so. Okay, let me make my statement very clear. Only if everything is the same and no new
Mhm.
findings. All right. So if you find new finding, you go back again to short interval follow-up with which is 6 months. Some of my patients who are high risk, or if I feel that this lump needs to be monitored very closely, I even shorten it to 3 months. Of course, only when necessary. And I'm talking about ultrasound, but the recommendation even for radiologists when they categorize it as BIRADS 3 is that's
Six.
short interval follow-up, and that's 6 months. Yeah. I tell my
Okay.
patients, you don't need to see me every day. And then I tell them, you can actually stop ultrasound. Of course, when there's already stabilization, okay, of the findings, meaning we don't see any changes within 2 years, okay, and they're below 40, no other risk factors. I actually advise them to, you can forgo ultrasound, but no one agrees. They usually would want it every year. So yeah,
Yeah.
those women are very particular, so they want to be checked.
Yes. So I think the few questions here remaining are myths about breast cancer. So I think this was asked during the poll. So is there any association between the length of use of bra and having breast cancer? And another one, this one is quite a new question for me, is having sex during menstrual period related to or associated with ovarian or breast cancer?
Okay, so the first question first, the uh, bra wearing, is it wired bra
It
or
wasn't mentioned, just
or
the
length of,
length
or
of
if you
time.
sleep you wear your
Yeah,
bra, yeah,
yes.
maybe like that.
Not removing it or
Okay, so there's no association for that. Okay, there's no association with wearing bra. Some of my patients after the biopsy, I actually even ask them to wear their bra so that to lessen the mobility of the breast and to avoid bleeding. So I think that answers the question already. So there's no, they can wear their bra as long as they're safe and they're intact and not allergic to that fabric. They can because some patients, they will present to you, they have irritant dermatitis because of the bra, and usually we don't if there's no indication for biopsy, we usually just give cream, and then it goes away and it gets treated. Okay, for the other one, can you repeat the question? It's like you,
having
a
sex
man
during
says,
menstrual period, is it associated with breast or ovarian cancer, or will
yeah,
you have
no,
breast cancer
okay.
if you
I
do
don't
it?
think that is associated with breast cancer. Okay, number one, sexual activity and then menses. I mentioned about menses, okay, but it's independent on the sexual, I mean, on the sexual intercourse or the activity. Um, Having menses, like prolonged period, meaning you had your menses first mens very early, like 8 years old. There are children who gets it, I mean, who get it at 8, 10 years old, and that's not very usual. The average women would have their first menstrual period at 11, 12, or 13. And the exposure to estrogen, high levels of estrogen, is what puts you to risk of breast cancer, and not the activity. Yeah. And
Okay, thank
for
you.
the risk factors for ovarian, they are different also. Okay, and when we estimate the risk, it's different as well. Although we have the genes that are associated with breast cancer, which is BRCA1, BRCA2, are also associated with increased risk of having ovarian cancer. But for risk factors like environmental, dietary, uh, and a lifestyle, okay, OB or GYN or the gynecologist would usually discuss what puts you to risk of having ovarian cancer. Yeah, I don't think I'm not in liberty to talk about ovarian cancer. That's not my specialty. But I will. What I can say is these two organs are interrelated. Okay, because the ovaries are the ones that produces the female hormones, and it influences changes in the breast. So that's what I can say. Thank you.
You already mentioned, doc, the BRCA1 and BRCA2 gene. So is there a difference between these two?
Yeah, BRCA1. Okay, I talked about it just
Yeah.
recently in our forum. So BRCA1 and BRCA2, they have okay. If I become too technical, all right, the location where the chromosomes are, that's the difference. Okay, where when you test for the specific gene like BRCA1, BRCA2, that's why we do multi-gene panel. Okay, when you test for a single gene like BRCA1, that only looks for a specific location at the genome. All right. So, but these two genes, when you say BRCA, it's breast cancer susceptibility gene. That's what it means. That's why it's shortened to BRCA. Okay, so BRCA1 are usually associated with the triple negative breast cancer, and then the BRCA2 are associated with hormone positive breast cancer. That's why when we have triple negative breast cancer, we usually would ask them to do age less than 60. Our threshold is higher. We ask them to do a genetic test because of triple negative. So that's the difference. But they're both are associated with breast cancer. Yeah. And
Thank you.
ovarian cancer also for the
Yes.
HBOC. Yeah, I won't talk about genetics.
Yeah, it's
People will
very
get bored. Will get bored.
okay, doc. So here's another question. Is COVID-19 vaccination safe for women with breast lumps?
Yes.
Right.
Yeah,
Okay,
it
so
is very safe. You can have it. Okay, even for my cancer patients who are not actively having treatment, meaning they're not on chemotherapy. Of course, we cannot mount the vaccine if they're undergoing chemotherapy, because the main effect of chemotherapy is on the immune system for actively dividing cells. So we wait for a while, okay, for our patients to have the vaccine first. But for patients who have already completed treatment, um, like they finished chemotherapy already, they can always have the COVID-19 vaccine. No indication. Oh, the only I may forget, but which is a very interesting point that I need to mention is when they have the vaccine. Okay, sometimes patients would experience axillary lump.
yeah.
That's lymphadenopathy because they put it on the arm,
Ah,
on the deltoid. So it's a reaction to the vaccine.
yes,
So
doc. I
we are
heard about that too.
yes, and there are a lot of patients who experience that. So what I tell them to do is when I have a patient to have, so talk to your doctor. We time the biopsy when it needs to be done. Okay, so like for example, you have the vaccine now, then we wait for 2 weeks. Most likely the lymph nodes are already back to normal. Yeah. So it's a good question. They might be surprised. Oh, I have a lump after the the vaccine. It's a side effect, but it is always proper to inform your healthcare provider. Yeah.
Yes, doc. So I think we're down to our last question. No, after talking about the different treatment options, no, you mentioned that very clearly in your lecture. Will you be able to declare a patient cancer free?
Yes. Yeah. So I always tell when once I think I mentioned that on the survivorship and surveillance. These are, we call them survivors. Okay, when if especially early stages, we resected the tumor with normal margin, and then um, our intent is curative, meaning it hasn't spread to other organs. Okay, so we're not talking about stage 4 diseases. I tell my patients when they go to me, you're cancer free, but we need to monitor you. because there's always a chance, even past 5 years or past 10 years, that it can come back. And that's the most dreaded threat of cancer surgeons. Yeah. So
Yes.
I tell them, you're cured. Yeah, and that's a big uh, um, impact. It has a big impact to my patients, and I will need to tell them that the cancer is out, you're free of cancer, you're receiving this additional treatment, okay, to prevent it from coming back.
Okay, thank you very much, Dr. Remy, for that. Now, before we end this part of the program, I would like to thank all the audience for all your interesting questions. I hope we were able to answer all of them, but a few questions I think were already lumped together. Okay, I would like to just reiterate, no, for before we end this session, that it has been always mentioned from the start of this webinar that prevention is always better than cure. And after knowing about the different risk factors for having breast cancer, we have the liberty to actually lessen our chances of developing this disease, no? And knowing your breast by simply doing your self breast examination is very important for early detection of all these lumps, diba? So early detection means early consultation with doctors, and all of these things would lead to better outcomes, just like what Doc Remy mentioned earlier. Now, I would like to ask for your last words, no, last words to impart to our audience who have been listening intently to this very nice webinar.
Okay.
Go, Doc.
So I think firstly, I would like to thank all our audience. We have a huge attendance today, and I'm very glad that a lot of people attended this webinar. It's a good start. It's first week of October, and we're already promoting breast cancer awareness. All right, and I hope that the lecture helped our audience to be well informed. I hope they picked up the right information from us, because that's what our purpose for today's afternoon. And once I hope I lessen the scare to the big C. Okay, because when patients go to me, the only question that they have in mind is, do I have cancer or not? But once you're diagnosed with we call it big C, I just call it C. uh, Breast cancer of all types, or in the field of cancer surgery, I think it's the most, if not one of the most studied and well researched in the field of oncology, not just medically, but surgically. So there are a lot of treatments. Do not be scared to go to the doctor. Even for my very advanced breast cancer patients, like stage 4, we can still offer treatment to improve quality of life. And for, of course, for early stages, we can assure them of a very high survival rate and a very good prognosis. So I hope that clarifies everything. And surgery for breast is not very morbid. Okay, we admit patients, and then the day after they go home. It's not a very complicated procedure. I'm not convincing everyone to have surgery, but what I'm trying to impart and imprint in everybody's mind is that breast cancer is existing, okay, but we have a lot of treatments that are available. So it's not the end of the world, and we have a lot of survivors that are living their lives normally. They're working, and they're back to their usual lifestyle. So, and with that, I thank everyone.
Again, thank you very much, Dr. Remy Velasco, and to all our audience for participating actively in our question and answer. With that, I'll now turn you over to our host, Miss Patricia Hizon.
Again, thank you so much, Dr. Remy and Dr. Helen. Wonderful messages from you both. That was really such a valuable experience for all of our Maxicare members today. To our attendees, thank you so much for participating in the Q&A and for, of course, being so engaged all the time. We really also appreciate how you are just really excited to know more and are sponges and you just really want to ask more questions. Now, to our dear Maxicare members, can we now invite you to please take a few moments to answer a feedback form? But you can do that after the event. We have with here on the chat the link already to the questionnaire and a QR code also that you can use to access that feedback form. Of course, your thoughts, your feedback would be most appreciated. Thank you so much in advance. Now, we will announce the winners of our raffle draw. Just watch out for your names, okay? Because the winners were randomly selected by our staff from amongst the attendees who share their most memorable Wellness Friday's event or topic and why. So like I mentioned earlier, one winner will receive a laptop bag, another winner will receive a foldable umbrella, and a winner will get a mini clutch bag. Are you ready to see if your name will be flashed on the screen? So let's flash their names on the screen right now. There you go. Oh, you get the laptop bag, another gets the foldable umbrella, and my favorite, mini clutch bag. I have yet to win. I don't think I'm part of it, but congratulations to all of you. Of course, our Maxicare team is waiting for you to chat with us right now and share your contact details. So please do so, and congratulations once again to our winners. Now, before you all go, may we again ask you just a couple of more questions? And here is our poll question right now. Which topics or activities would you like to see in our next Wellness Fridays? And you can choose, of course, more than one answer because you have amongst the choices skin diseases awareness and cure, proper nutrition in the burn months, lalo na, December is coming up so fast, emergency preparedness, oh, that's a good one, productivity hacks for work from home employees, and mental health wellness. Hindi talaga nawawala those types of great topics that all of you are always looking forward to check. And let's show now the poll results. See, we're very consistent in what we always are looking for. And we really appreciate you guys sharing your insights. Of course, these are also topics that I'm most interested in. But here is another series of poll questions. On a scale of 1 to 5, 5 being the most, how do you think this webinar will help you live your best life? On a scale of 1 to 5, how do you think this, with the topic on breast cancer awareness, will help you live your best life? Of course, all of us need to be aware. So that's the second question. And the final question that we'll be asking without having to show you the results on a scale of 1 to 5, 5 being the most, how likely are you to recommend the next events to others? Please do share with us your thoughts on a scale of 1 to 5. Now, if you enjoyed this experience, please do share it on your social media using the hashtags Live Your Best Life and the hashtag Maxicare Wellness Fridays. And you can tag Maxicare on Facebook. That's at Maxicare Healthcare Corp. Their IG is at Maxicare Healthcare. The health and wellness also have Maxicare Health and Wellness, and you can tag any or all of them when you share about your wonderful takeaways for this event. And you can also subscribe to their YouTube channel to learn more and to get more wonderful content. That's Maxicare Healthcare Corporation. Now, to learn more about Maxicare's products, please visit their shop. That is www.shop.maxicare.com.ph, or you can send a message to their FB Messenger. If you have questions about Maxicare's Wellness Fridays, you may send an email also to maxicarewebinar@maxicare.com.ph. See you guys at our next Maxicare Wellness Fridays, which will be on October 22 at 5 p.m. as we talk about isolated but not alone with Dr. Vanessa Kathleen Kainghug. The QR code for the registration will be flashed on your screens, or is being flashed on your screens. Make sure you please register early. I'm sure that a lot of you will really pick up great insights. But that ends our event for today. Thank you so much for being with us. We hope that you enjoyed and were able to take away meaningful information. Thanks again and have a great evening. We know that with Maxicare, you can live your best life.